I'd like to go over the brief steps of cataract surgery. So first of all, where is the cataract? Here's the cross-section of an eyeball, and cataract sits somewhat in the middle part of the eye, right over here. So cataract surgery means removing the cataract, and what you've got left is this structure here called the human bag. And once the cataract is out, your surgeon will put in an implant. This implant is meant to outlive you and your surgeon. This implant will allow light. So light's going to be coming from here. It'll bend because of your cornea. It'll engage the lens, and the lens will further focus the light onto the retina. And then the light will go from the optic nerve to your brain. So during cataract surgery, now cataract surgery typically, it varies. Sometimes a case can take 10 minutes, sometimes 15 minutes, sometimes shorter, sometimes longer. I always tell patients that it's not a race, but what's involved? So this is the front view of the eye. And here you've got the iris, okay? Now, at the start of the surgery, we don't expect patients to be able to keep their eyes open for 10 or 15 minutes. So how do we prevent that? We place something called a speculum, and the speculum will push your eyelids and your eyelashes out of the way. And once the speculum is in, which doesn't hurt, you will not be able to blink. Even if you wanted to, you will not be able to blink. And that often gives patients comfort because they're always worried, what if I blink? So what's the next step? The next step, and this is of course after all the freezing and everything. The nice thing about cataract surgery is typically all the freezing is done with eye drops and ointments. There isn't a big needle that goes into the eye to freeze the eye. So what's the next step? Well, I'm just going to kind of simplify it to you, but the next step involves making a very small little incision. And that's done with a microscopic, it's done with a small blade. It goes into the eye and it makes a small little opening. And we're going to use that opening for the next step. So what's the next step? Well, the next step is your surgeon will, using a cannula, will inject a bit of freezing inside your eye. And that will give the eye a little bit more freezing. You already had freezing with drops and ointments, but now your surgeon is going to give you more freezing inside the eye. So we'll get rid of this, and we're back to square one. Now, your surgeon will use this little incision that he or she made. So after the freezing, your surgeon will then inject jelly into the eye. And what that jelly does is it gives the eye a bit more working space. It's more cushion into the eye, and that's called a viscoelastic. It is mandatory for your surgeon to put gel in the eye. And so again, we have that incision there, and that now the eye is full of this healthy gel that will keep the eye formed. Next, your surgeon will make another incision, and this incision will be, again, using a blade. It will be a little bit bigger. Okay, so this will be the second incision. Now the incisions, where they're located, some surgeons operate, they move this incision here, some have the small incision on the other side. It doesn't matter, it's just semantics. But the take-home point is with cataracts or modern cataract surgery, you're using two incisions. So now that the eye is full of gel, it's safe to start the next step, which is making an opening into the cataract. So the cataract, think of it like a big sphere. So what your surgeon will do next is he or she will use a small little instrument to create a little opening into the cataract, just like that. And then they will use forceps through this incision, and they will basically make a circle into the cataract, into the front part of the cataract. And this step is called the capsulorhexis step. So what does that look like in cross-section? Well, Here's the cataract in the cross section. What your surgeon is doing is making an opening right here. So it looks just like that. So this is the cataract. That's the cataract. Surgeon makes an opening. This is the opening. That way you can gain access into the cataract. Okay, so that is done with forceps. The next step is your surgeon will use ultrasonic energy. Using an ultrasound probe, this probe will go into the eye. And right before this step, by the way, it's not super relevant, but your surgeon will also administer fluid around the lens to loosen it up. So your surgeon will use an ultrasound probe, and they'll use a second instrument. So this is a metallic instrument, and they'll use the ultrasound to break up the cataract into different sized pieces. Often the cataract starts like a sphere, and then it's broken up into 2 pieces, and then broken up into 4 pieces. And so your cataract will go from, and we'll just modify that here. So just make a little adjustment here. So your cataract will go, instead of being a sphere, it'll be broken up into 4 sized pieces. And then and that can be done mechanically or with ultrasound. And then each piece will be emulsified or removed by the ultrasound probe. After that, the cataract is removed. There's always little strands left in the cataract that's removed as well. And so once that's all done, all the instruments are removed. And now your surgeon is basically left with an eye that no longer has a cataract, but is left with what we call the human bag. So the human bag has a cross section. So you had a cataract here, now it's gone, there's nothing left in the human bag. So the next step is, the surgery's not over yet. Now your surgeon, through this incision again, will inject an intraocular lens. The intraocular lens looks something like this. Your surgeon will fold it in half and then inject the lens, and the lens will unfold and stay inside the capsular bag. So here's the lens as a cross section. And that's what's going to help you see well. So once the lens is in, as you may remember, we put gel in the beginning. The gel can't stay in the eye, so your surgeon will use vacuum to take out all the gel. And what you're left with is the following. Here's your eyeball again. There's the incision that your surgeon made. Here's the nice implant that's inside the bag. Okay? And so the gel has been removed. Now your surgeon will fill the eye with antibiotics. And so they'll use a cannula on a syringe and inject antibiotics both in this incision, and inside the eye to prevent infections. And that's basically the surgery. Afterwards, your surgeon will remove the speculum. That way you can blink again. And that's basically the surgery in a nutshell. I'll be posting some other videos to kind of make it a little bit more easy to understand. But the take-home point, though, is throughout the surgery, you should not be able to feel anything. You may feel some pressure, but in terms of sharp pain with these instruments that I just mentioned, there's zero pain. That's the nice thing about this procedure, is that we can do the entire procedure just with drops and ointments, no needles. Anyways, I hope you found this to be useful.